Welcome to Organizational Resilience Part 1, Organizational Commitment and Workforce Assessment. Before we get started on today's webinar, we're going to open up a quick poll. You could please fill it out to help us get a sense of who's in the room. You should be seeing that poll pop up on the right-hand side of your screen. And I will hand it off now to Diane Fabi-King from HRSA.
Thank you. Good afternoon, everyone. My name is Diane Fabi-King, and I am a Senior Public Health Advisor in the National Health Service Corps under the Bureau of Health Workforce. It is my pleasure to welcome you to our webinar today on organizational resilience. The readiness series that we are doing is an intentional step taken to assist you as our NHSC members in becoming culturally competent clinicians through experiences and trainings in root causes of health inequities. And we hope that all of the series that you have joined or will be joining will be of fruitfulness to you in your endeavors as an NHSC clinician in service and before you get into service. So I want to turn this back over to Sarah to say thank you and welcome to our series.
Thanks, Diane. We're so glad all of you are here with us today. This is the first webinar in a 3-part mini-series on organizational resilience. My name is Sarah Guduma. I'm a project coordinator and specialist at the Association of Clinicians for the Underserved, and I will be your moderator today. Clinicians strive to meet organizational quality and productivity goals while managing the needs of their patients. Operating within a complex system shaped by the competing priorities of leadership, third-party payers, and policymakers can be challenging, as workers face an increasing number of stressors, their well-being, and in turn, their performance can suffer. Resilient organizations have systems in place to help clinicians manage stress. These organizations can adapt and transform to meet new challenges without compromising the health of their workforce. Creating a resilient organization addresses the underlying issues contributing to clinician stress and burnout and places the focus of improvement on the system rather than on a single clinician. Over the course of this mini-series, we'll explore 6 domains of evidence-based and promising practices shown to increase clinician well-being identified by the National Academy of Medicine. We'll provide action steps to build organizational resilience and highlight tools and resources to help you develop a plan that meets the needs of your organization. Today, we'll dive into the first 2 domains, organizational commitment and workforce assessment. Be sure to register for the rest of the webinars in our ongoing mini-series that will focus on the topics of leadership, policy, efficiency, and support. I'm excited to introduce today's speaker, Suzanne Spears. Suzanne Spears joined ACU, the Association of Clinicians for the Underserved, in 2017 and serves as Senior Director of Workforce Development. In this role, she oversees ACU's national training and technical assistance partner, the STAR Center. She works directly with community health centers, state primary care associations, and other national training and technical assistance partners across the nation, addressing the important issues related to workforce. She has worked with community health centers for almost a decade, first by recruiting providers at the Virginia Community Healthcare Association. She received a Bachelor of Science from the Virginia Commonwealth University. Before I hand the mic over to Suzanne to get started, I'd like to go over a few housekeeping items. This webinar is being recorded, and a link to the recording will be emailed to you within 2 days. The PowerPoint slides can be found on the webinar registration page, which we'll link in the chat now. Related documents and resources are also available on the webinar registration page. We'll have time for Q&A at discussion points throughout this presentation and at the end, so please type questions that you have in the chat box as we go through this presentation. You may have to manually open the chat box by clicking the chat icon, which is located in the bottom right-hand corner of your screen. If you have any questions and require technical assistance, please contact our colleague Josh. His information is pasted in the chat as well. To see closed captions, click on the CC icon in the bottom left corner of the webinar window. That's it for housekeeping, so I will hand the mic over to Suzanne now.
Hi, everyone. Good afternoon or good morning, depending on when you are or where you are joining us from. Thank you again for having me today, and I'm so excited to speak to this really important topic about organizational commitment and workforce assessment in regards to organizational resilience. So what are we going to talk about today? We're going to speak to three specific goals that we're going to have as learning objectives today. So after this session, you will be able to define organizational resilience. You will also be able to discuss, we will be, discussing the significance of the organizational commitment to resilience. And then we're also going to talk and speak through and identify, rather, evidence-based and best practices for assessing workforce well-being as a precursor to developing our well-being programs. So organizational resilience. What is organizational resilience? Well, it is an organization's ability to continue to function in the face of adversity. It is not simply surviving adversity, but the ability to adapt and transform and meet challenges. So when we think about organizational resilience, this is something that is really important. Resilience is not only going to prevent, it's not going to prevent, rather, clinicians from facing high stress environments. There's really no way that we can take stress out of what we do, especially after the last 3 years. And it's not going to limit our exposure to burnout factors. It will help them develop their resiliency, sort of their resiliency muscles, right? And by developing this resiliency, clinicians will be better equipped to respond to stress and enabling them to better support their own well-being as well as that of their patients, right? Because if we're not well as caregivers, as clinicians, then it's really hard for us to take care of the ones that we're supposed to be helping in the first place. And again, I mentioned resiliency is really about sort of building muscles, and it truly is. It's a practice. It's something we have to think about. It's something we have to address. It's not necessarily innate, right? Some of us are naturally more resilient than others, but throughout this series, we're going to be talking about, specifically today, about what organizations can do to really build up that clinician resilience, to face adversity, to transform, adapt, meet those challenges that we know we're going to face, right? The last 3 years have been extremely challenging. And so by having an organizational commitment, it really does help us to be able to face those challenges, adapt, overcome, and then take better care of ourselves and our patients as well. Okay, so when we think about the different types of organizational resilience, there are a few of these. So if we're talking about planned resilience, this is really when we're thinking about planning or preparing for a future crisis. So this would be, okay, if another global pandemic came, how would we help our clinicians be better equipped to overcome those challenges? When we're talking about adaptive resilience, we're talking about adapting to chronic stresses and acute shocks. This is something that, this is our sort of like a day-to-day. How do we adapt to what we just have in our normal, not in our normal lives, but just like things that we are just chronically stressed out about, things that we necessarily can't control, but that we really, they're just, oh my gosh, they're there and we just need to overcome them. And then there's also everyday resilience, and that is the ability to function through chronic stress in day-to-day practice, right? So these are our everyday things that we deal with. These are things like patient panel, our patient load, or our just anything that relates to our everyday stressors and things that we just need to be able to have the ability to overcome and function through on a day-to-day basis. And so how we're going to discuss organizational resilience. As Sarah mentioned at the top of the hour, this is the first part of a two-part series. And so the National Academy of Medicine has these 6 domains of evidence-based and promising practices shown to increase clinician well-being. I believe in the next slide, Sarah is going to put into chat the link to the National Academies of Medicine website as it relates to organizational resilience and well-being. They have some great resources. Anyway, they have these 6 domains, and the ones that we're going to talk about today are that organizational commitment and then that workforce assessment. And so when we think about organizational resilience as a whole, these two, thank you, Sarah, these two are really the first steps into developing that organizational resilience as a whole. And so apologies. And so then the last 4 are going to be in sessions following this one. Okay, So when we think about guiding principles, we want to think about these 5 different areas. And so first of all, when we're thinking about implementing an intervention as it relates to developing organizational resistance, first of all, you want to focus on the bright spots. This is not something that you just want to focus specifically on what's bad. We want to take an asset-based approach to really taking a look at what is going well. Where are the things that we shine, things that we shine at first? And by doing that and by looking at our assets, then we can then turn to things that maybe we don't do so well and we want to be better at. And so by looking at the glass half full first before we're looking at what is not there, it really is going to allow us to really really start off on the right foot and really focus on those positives. And then second, we are focusing here on system interventions. This is not necessarily based on personally what can clinicians do themselves on their own time or just within their own personal, who they are, right? When we're talking about interventions, this is really talking about a systems-based approach organizationally to how we are going to develop organizational resilience. So that's a really, really big one. And then number 3, we need as leaders, and I was just writing down when the first Slido came out, who is on the team. And so there are a lot of leaders on this webinar today. And so we want to commit as leaders to a culture of organizational resilience and also system transformation. This takes work and it takes commitment from leadership, both senior leadership and middle management, to really take it to the next level and really implement these things that we're going to be talking about over the next several webinars. And so we have to really have that commitment. Fourth, we need to co-create solutions. This is not necessarily going to be something that is going to come from leadership or middle management, right? It's going to be something we really recommend, or these guiding principles that the National Academy of Medicine has, they recommend wholeheartedly that you have both leaders as well as your staff coming together to figure out solutions of those things that maybe you're not doing so well. When we're thinking about things that we aren't doing so well that we really want to have systems interventions for, think about things and bring together all staff, because we want to hear from everybody. At the end of the day, if we're going to have a culture and commit to this culture from the top, right, and from our leadership, we want to make sure that everyone has a say in creating these solutions. There are things that one person might not think of or say that's important, or say that, or have an idea for helping to create these interventions and, creating these transformations, that another person might have a wonderful idea. And so if we don't include the bulk of our team here in these solutions, it's really going to miss out, and we're really going to really take an important piece out of this organizational commitment here. And then finally, we want to make sure that we're measuring all of these practices and these policies that we're putting into place by measuring what matters and also keeping it very, very simple, right? And so by measuring all of these different interventions, these systems, all of these different things we want to put in place, make sure that we are measuring what we're putting into place. Data is so important. We're going to talk a little bit about that in a minute. But when we have the data to take a look at these systems interventions we're putting together, then we're going to see if we need to pivot and have other things that we need to do, or if what we have put into place is working. So think about that when we're thinking about interventions, systems, all of those different things. Just make sure that at the end of the day, we want to be measuring these interventions and these practices and what matters about those practices, and keep it simple by doing all of these things, because sometimes the simplest practices can be the best. Okay, so now we're going to really hone in on our organizational commitment. So as an organization, we want to take an action step. And our first action step is that we want to make sure that we are establishing a workforce well-being program. If we already have a workforce well-being program, that we are assessing it and tweaking it, if you will, to make it even better. It could have been that you have a workforce well-being program that you put in as a part, even maybe because of COVID or even pre-COVID, that you had one. And if you did, kudos to you. But if you didn't, we want to make sure that we're establishing a workforce well-being program. And then, as mentioned in the last slide, we want to make sure that we are including measures of workforce well-being within the organization's strategic plan and data dashboard. There are a lot of things that, as a workforce well-being program, that we need to put in our strategic plan because they're probably not going to happen overnight. And so we want to make sure that we're methodic and strategic about the ways that we are developing these workforce well-being programs and the way that we're carrying them out. Okay, so when we think about establishing a an organizational well-being program, we want to make sure that first we know where we are. If we don't know where we currently are, then we can't really figure out where we're going to go. And so the first step in establishing an organizational well-being program is to figure out our current state of our workforce. And so for this, we want to ask a few questions and take a look at things like our burnout scores. Do we have a measure that tells us what our burnout scores are? And if we don't, we're going to talk a little bit about that in a minute. We also want to think about things like staff satisfaction ratings. If you're doing a staff satisfaction survey or employee engagement survey or any of those type of surveys, you want to make sure that you take a look at those things. Then we also want to look at things like our turnover rates, our retention rates. What are those saying about the current state of our workforce? And then you also want to look at not only those scores and ratings, but then you really want to take a really significant look at what are the contributors to burnout, right? So what are those pain points that might be affecting our workforce and more specifically our clinicians, right? So some of those things that could be contributing to burnout are things like too much time on documentation, too little time that is enabled for us or the clinicians to be able to do that documentation. Also, no decision-making authority, right? That they have to go to somebody to, to make something happen and they can't do it themselves. Feeling undervalued and having no work-life balance or really having that tough work-life integration there. And then we also want to think about things that we're doing, such as those organizational plans to keep the workforce physically and psychologically safe during disasters and public health emergencies, right? So all of these things we want to make sure that we are taking a look at. We really want to take a holistic view of what is currently going on with our workforce. There also could be some other things that you could be doing within your organization to gather data on a historic basis that you want to make sure that you're pulling in there. So once we have all of those questions answered and those different scores together, we, look through them and we really do an analysis. And through that analysis, we say, okay, this is where we are now. And then we figure out, okay, well, this is where we want to go. So that desired state of workforce. And then in the middle there, as you see, is that strategic plan. And that strategic plan allows us to get from where we currently are to where we want to go. And so by having a plan, we are going to systematically take different steps to improve the current state of our workforce and then have that organizational well-being program. So it doesn't happen overnight. And hopefully this slide really showcases that. And that I will also say as a note, as we talk about this, especially the leaders in our virtual space here today, that this is something that is not going to happen overnight, but is absolutely doable. So when we talk about all these things, Try not to get overwhelmed as a leader, but know that this is possible and you can take these steps to get to your desired state of workforce and to have that organizational well-being program. Okay. So a few things when we think about establishing an organizational well-being program, some of the things that are really foundational and super important when we think about these programs. So first of all, we want to make sure that we have resources for clinicians in distress. This is so important. It is imperative that we are supporting our clinicians that are serving our patients, right? And so if they're in distress for whatever reason, we want to make sure that they have what they need in order to get them through that time of distress or that time of crisis. We also want to make sure that we have resources on an organizational level to address the needs of individuals during major life transitions. These are things that, happen to all of us, right? So, name 10 things that that happened both inside and outside of the workspace that necessarily aren't triggered by something that is going on at work, but that a move, a divorce, those type of things, that we want to make sure that those major life transitions, that we have a plan in place to really support and help those individuals as they need it. And then we want to make sure that the third thing we want to think about is really having those approaches, those system-wide approaches to providing clinicians the opportunity to both identify and also prioritize those things that irritate them, right? Like pebbles in the shoes, as the slide says, and the process that empowers them to address these, right? So what are things that that they can do that really are just issues for them, but that they can solve easily? Like, is there a workflow that might be easily changed that really is something that is just it is just one more thing that they have to do, or the order is really throwing folks off? But think about that, right? And so what is going to help them really really help them in their day-to-day there from a systems perspective? Some more of these foundational programs include the administration, reducing the administrative burden placed on physicians. Is documenting something that is really taking up a lot of time, and that is something that is leading them for their work-life balance to be off. So maybe hiring a scribe is something that they can do. I know that there are centers out there that have hired scribes for physicians. If they're able to see 2 more patients a day, then they're able to hire that scribe, right? So obviously there's some trade-offs, but think about things that we can do to reduce that administrative burden. There is not a lot that we can do to, the documentation has to be there. There are a lot of other things that our physicians have to do in healthcare today. And so any way that we can reduce the administrative burden is always, always welcome. We also want to make sure that we are encouraging leaders to model self-compassion and also cultivate a sense of connection within the organization. It's often our leaders who are the people who are not doing what they are telling everyone else to do, right? And so, and not being easy on themselves, not being kind to themselves. And so we want to make sure that we have leaders that are encouraged to model those things, right? And so really cultivating those connections through those leaders really goes a long way to organizational well-being, and is really important foundational program and foundational element of a well-being program. And then finally, when we're talking about foundational programs, we want to make sure that we are, just like internally, we're also looking externally and engaging in those partnerships outside of our organizations to support organizational growth and learning created to clinician well-being. just like you're on this webinar today, there are a bunch of resources. Again, Sarah's put one into chat, and we are also, there are also a ton of other resources out there. For instance, the STAR Center, which stands for Solutions Training and Assistance for Recruitment and Retention, has a podcast. And this latest season, it is talking about organizations that are helping to address burnout and compassion fatigue within their organizations, right? And so just like those things, like listening to podcasts, listening to webinars, there are a ton of resources. The National Academy of Medicine is out there. And so really take a look at those external partners and partnerships that can help you learn and understand what you might do as an organization to better create these programs. Okay, and so what we're going to do now is the first of several of these slides, but we really want to hear from you. So what safety net resources do you have in place for clinicians in distress? So we have opened up a Slido, and then Sarah is also going to come on and she is going to mention how, if you would like to engage in a conversation about this, how you can do that.
Thanks, Suzanne. As Suzanne said, we'd really love to hear more from you, not just through the polls, but also by having kind of discussions about these topics throughout. So when we get to one of these discussion points, such as this, we really encourage you to all to share your thoughts. So you can do that through two ways. If you feel like sharing aloud, you can click the raise hand icon, which can be found at the bar at the bottom of your screen towards the center right. If selected, you'll receive a request to unmute, which you can then unmute and share your thoughts, ask your questions aloud to the whole group. And just as a reminder, please wait to mute yourself again until your question has been fully answered. If you don't feel comfortable sharing aloud right now, you can also share your thoughts and questions in the chat box. I see we have Erin raising her hand. I'm sending you a request to unmute now, Erin.
Hi, Erin.
Hey, Erin. Off. Oh, can you hear me?
Yes, it looks like sounds like there's a little bit of an echo, but
I'm not sure why. I'm not on any other device here.
okay. I'll go ahead and mute myself while you speak then, Erin. I'd love to hear from you.
Okay, thank you. So our organization offers the EAP, the Employee Assistance Program. So that's what's recommended. But I would definitely be interested in seeing some of these other options that are listed here, like structured peer support programs, or, how to get that started here, professional coaching as well.
Thanks, Erin. Yeah, the EAP programs are so common and such a wonderful way to support our staff with in that confidential environment. So thank you so much for mentioning the EAP. So as Erin mentioned, we have some in our Slido. I'm just going to sort of read out what you all are doing to support have those safety net resources in place to support clinicians in distress. So 20% of those who answered the Slido poll said that they have structured peer support programs. 12% said that they have professional coaching. Then we have 8% who said they have an other program that they have that maybe necessarily isn't listed. And then we have some folks that don't have any safety net resources in place, and that's okay. But thank you so much for your answer there. So we'd love to hear from some of you. Feel free to put those if you had other in the poll, or you just want to give examples of the type of programs that you have. We'd love to hear from you either in chat or via voice by raising your hand and having Sarah unmute you. There's so many good ones out there. We'd love to hear. Does anyone else have anything else besides an EAP that they'd like to share about before we move on? Okay. So we have someone in the chat who mentioned that they have a new single session support center. That's awesome. Now, when you speak to the single session support center, is that a single session, like a single therapy session that that folks can go to, or how does that work? Okay, thank you so much for clarifying. So they said that they have a 20-minute single therapy session from what they understand. That is fantastic. That, you know, just that go-to place where you know you have 20 minutes where you can just talk to someone and have them hear you. That is so wonderful, especially if you're in crisis and really that critical moment where you just need someone to listen to you. That's really great. Anybody have anything else that they'd like to share? Okay, so while you're thinking about that, let's move on to our next poll question. So what resources do you have to address the individual's the needs of individuals during major life transitions? So we've got a few options there in Slido along with an other. And if you would like to, if you check other, feel free to put what that other thing is in chat. So a couple of the ones that we have in our Slido are access to mental health resources, structured peer support programs, financial support like retirement planning, parental leave policies, and also campaigns to reduce stigma and encourage the use of resources, right? So those EAP programs, a lot of times folks are afraid to use them because they're worried that they're not confidential. And so that's really important as well. So right now, we have 53% of the folks that took the poll mentioned that they have access to mental health resources. 53% of those that took the poll have parental leave policies. Yes, such a major life transition that I didn't mention as an example. 40% said that they offer financial support for those life transitions, such as retirement planning. 13% said that they have campaigns to reduce stigma and encourage the use of the resources that they have. And then 13% of you said that you have structured peer support programs. And then we also do have quite a few folks, about a quarter of folks that answered the poll, so they have another program that is not listed there. So anyone else want to share, either through unmuting themselves or in the chat, some specific things relating to the needs of folks during those major life transitions, such as the length of your parental leave policy or the type of mental health resources that you might have? Feel free to just put it in the chat if you'd like, or ask to be unmuted. All right. Well, I don't see anything in the chat, and I just want to make sure that no one has asked to be unmuted here. Gotta open my, okay. All right. Well, thanks for answering the poll, and great to hear, great to see rather, the things that you are doing to support individuals in their major life transitions there. All right. So last question as it relates to all of these supports and resources. So how do you promote these resources? What do you do to help folks understand, you know, what their resources are? For instance, as Irene put in the chat, that they also have the personal leave available to employees that may not qualify for FMLA. That's awesome. So how do we promote these resources? And you can put that into Slido there, and it'll come up, and we'll be able to see how everyone is making their resources known. Okay. So this is fantastic. Okay, so we have email. Folks promote these resources through email. They communicate them in staff meetings. They have message boards, putting things on the intranet, visiting division meetings, tabling, meetings, flyers. Oh, that's a good one. Yes, putting it up in the break room. That's a great way to do that. That's awesome. Email. All right, so it looks like email is has really been elevated as something, a way that you all are promoting those resources. And yes, email is great. It's wonderful. Sort of, even though we get lots of email during the day, it's still evergreen, right? It's going to be in your inbox unless you delete it. And so if there's something that someone sees that they can't, that they can't get to right then, at least it's there, and that they come back to it and they can really see what those offerings are and those resources are that you are doing. And then staff meetings are the other, it looks like the other thing that came up as a way that you're promoting those resources. Yes, another great way to do it. Email is wonderful because it's really an evergreen resource, or not an evergreen, but it's just something that's, that's available, continually there that folks can look at. But staff meetings are great because everybody's at a staff meeting. And so if you're promoting things and, having a resource per week or per month or however you all do it, then we know everyone's there and able to listen and engage right then, and they're not necessarily distracted there. So awesome. Thank you guys so much for engaging in those few slides as it relates to your resources. All right, so now we're going to move on to our workforce assessment. Okay, so some action steps as it relates to our workforce assessment. So we're going to want to measure clinician well-being using some standardized tools, and we will show you a few of those tools in just a minute here. But really, so measuring clinician well-being across the board. We're also going to think about assessing our workforce well-being through conducting stay interviews. That's another really great way to do it. We also want to leverage our HR data, our human resources data, and also benchmarks that we might have. And then we want to make sure, as a part of our workforce well-being, that we are addressing bias and discrimination in the workplace, because bias and discrimination is one of the factors that leads to clinician burnout, really leads to the opposite of clinician well-being. And so we want to make sure there's a part of that we are looking at bias and discrimination when we're thinking about doing a workforce assessment. Okay, I mentioned those standardized tools. There are a ton of workforce assessments out there that are evidence-based and that are really, really wonderful. And so if you haven't done a workforce assessment or used any of these tools, I would encourage you to do so, or rather have your clinicians fill these out, because these really look at a bunch of different things as it relates to resilience and burnout. This chart is wonderful because it gives the burnout tool, such as the Mini-Z, the ProQuil 5, the BAT, the burnout self-assessment tool, and then the MBI, the Maslow burnout inventory. They do a great job at looking at a bunch of different dimensions of burnout. And as you can see in this chart, there are specific elements and dimensions that each one of these measures, right? Everything from disengagement to compassion satisfaction, to secondary traumatic stress, to emotional impairment, or emotional exhaustion, right? And so each of these has the things that they're really looking at. So there could be, one or two that you might pick, or just one. Whatever it is that you do, these tools do a really wonderful job at assessing well-being and various degrees of burnout. One thing I did want to share with you, while it's not evidence-based, the Star Center does have an organizational burnout assessment tool, really taking a look at organizational capacity to to really recognize and address burnout from an organizational level. And Sarah is going to put that in a chat in a minute. But again, whatever it is that you're doing, just make sure that we're assessing it, because if we don't know where we want to go, or if we don't know, if we don't know where we are, it's hard for us to know how to get to our optimal state of well-being and really how we develop that, that strategic plan there. Okay, when we think about developing and deploying a workforce assessment to measure clinician well-being, we want to think, we want to really do it intentionally, right? And so in order to do that, we want to make sure that it's something that we have a plan for, right? It's something that we want to make sure that we are very intentional about the timing of it, the opportunity for folks to actually complete the survey. Setting aside paid time to do this is not something that we are going to want to have them do on their own time, and that we are very also intentional about letting folks know about it. So before it comes out, make sure that everyone knows and understands that it's going to be coming out, why you're doing it, what you hope to gain from this assessment. Hopefully that it's anonymous if they want it to be, and that you're really really have a whole plan around this assessment. And then I sort of mentioned it with the intention part, but communication. I want to make sure that folks know about this well in advance, that it's coming, that they're informed about it, that they are that they have any questions answered about it, right? That's a big thing when it comes to these types of surveys, especially when it comes to things that folks feel very that might be very personal to them. And so any questions that folks might have, you want to make sure you're addressing those ahead of time and really doing a wonderful job about communicating those things and really being thorough about your communication about the survey. You also want to make sure that you're consistent about this, right? So make sure that if this is something that's for all staff, that you have all staff fill it out, that you're consistent across the board. If it's just for clinicians, that it's just for clinicians. However it is, you want to make sure you're consistent and that everyone is getting the same survey, so you can have data that looks across the board, right? And so that consistency is really important when we are gathering data to make it something that we can make some actionable steps on. And then finally, accountability. This is something that is really hard when it comes to being an organization and trying to put this together. Organizations have to be accountable for what they are seeing and also the programs that they're putting into place. And so as an organization, if we are going to ask people what they need or where they are, then we are going to be accountable to do something about that, right? And a lot of times, to get this really crucial data, even though it might be anonymous and you can't address individual specific concerns, we want to make sure that we're doing things to be able to make sure that folks are taken care of. Again, by being physically safe, we want to make sure folks are physically safe as well as psychologically safe. And this accountability piece is really important when it comes to psychological safety, because if you ask folks what their current state of being is and they're not willing to do something about it, that's really going to be detrimental. And so before you do this, you want to make sure that your organization is committed to really having those systematic approaches to making things better, and that creating that culture of well-being. So definitely something to think about when we're talking about doing an assessment. All right, so more interactivity. So how are you measuring workforce well-being? Are you using one of those tools that was in one of those slides? Are you using something that you created within themselves? What are you doing and how are you measuring clinician well-being? And again, this is a free answer in the Slido, which is great. So are you doing a survey? Are you doing listening sessions? How are you measuring workforce well-being at your organization? And if you're not measuring well-being, you can say that too currently, and that's okay. Okay, so I'm just going to read out this just gives a list of what folks are doing, and so I will read out what you all are doing to measure workforce well-being. So one person said that they have a safe space for staff to let you know what's going on and what's bothering them. That's wonderful. Really creating that that place where they feel empowered to do so. Okay, so this person said they just started with the organization, so I'm not quite up to speed on everything that they offer yet. That you can't offer anything, but that's okay. Focus groups and surveys, more surveys, check-ins with supervisors. Yes, that one-on-one time is so vitally important. And even if you're not collecting quantitative data, you still have that qualitative data, which is so very important. Surveys, stay interviews. Yes, what a wonderful tool. And we're going to talk about this in a minute. Employee rounding. Yes, I love that. Surveys, employee satisfaction surveys. And a few of you said that you aren't measuring things, and that's okay, right? And so that's one of the great things about coming to these sessions is that you can get ideas. And if you're a leader who's not doing a survey yet, that's okay. Don't take that as, that is, that's a bad thing. You're here to learn. And so it's our hope that you'll take something away from this and start doing this. A couple other things have come in. So this person said that they have monthly care team meetings where their care teams can touch base with each other, give feedback, ask questions of leadership, and they also have mentorship meetings as well between clinicians. Kudos, that's really awesome. And again, that chance to get that qualitative data about workforce well-being is so important, and just as important as doing surveys. And so I love that. Awesome. Thank you guys for sharing what you're doing. And also those of you who aren't doing it, thank you for sharing that as well, because that's also great to know. Okay, great. Thank you again. Okay, so when we are thinking about doing our workforce assessment, these are just a few examples of things that you can measure or track on a data dashboard as it relates to organizational well-being. And so we can take a look at the responses we get to surveys, survey completions and responses, right? And so those can be related to burnout, satisfaction, engagement. Ooh, this is a big one. Time in EHR, right? How many of us feel like they spend a lot of time in EHR? There are a lot of us. Purpose in work. This is a big one, especially when we are working with in underserved communities, with historically marginalized and underserved populations. And really that connection and purpose in your work is so very important. And so if you don't have that purpose in work and you're working in an area where the folks that come into your organizations as patients, they have a lot of needs. And so if you don't have that purpose, that connection to that can be really hard. And then also team cohesion, that is vitally important. If we are not connected with our team, if we're not jiving, that is important. And so if our team cohesion is off, we want to make sure that as an organization and as part of our strategic plan, that we are putting things in place to really address team cohesion and have opportunities where folks can increase their team cohesion. Because let's face it, we spend more time at work than we do at home. And so by having that, by having healthy and also prioritizing team cohesion is really important. And so that is something that is important to measure, because it really does have a huge effect on our overall satisfaction as it relates to to satisfaction. And so when we're thinking about measuring staff satisfaction, really think about incorporating all of these different elements and more. This is not an exhaustive list, but you want to make sure that you're looking at several items to make sure that you are looking at things that you can really move the needle on and really make progress on, right? And so, really, and also we're able to share our progress. As I mentioned too, we want to be as transparent as possible with these things. Leadership might not be able to share everything, but to the extent possible, really we want to make sure that we are sharing our progress as it relates to these programs for all staff, right? And then we also want to make sure that we are looking at these different assessments by site and discipline. Now, if we get a little bit more, we also want to make sure that we're not so compartmentalized that if folks want to take this with anonymity in mind, that we're not giving away their anonymity. But it's important, if an organization has 20 sites, then their staff satisfaction could be wildly different. And these scores could be wildly different at every site. And so some sites might have one thing that they need to work on versus the other one isn't so much. And so we really want to make sure that we are helping ourselves as leaders understand the type of interventions and systems we need to put in place by site and also discipline. So make sure we are also thinking about that when it comes to when it comes to those sites and different disciplines, because again, just like the teams are different, right? And so we want to make sure that we're looking at things across the board and really helping to understand where we need to place our interventions and our programs to have the greatest success. Okay, so we talked a little bit about this a minute ago, but something that we can also do to assess what our workforce, or really our current state of our workforce, and some of you mentioned in the last Slido, were stay interviews. Stay interviews are amazing. They are a powerful way to understand what clinicians enjoy about their work, why they stay, and what changes they would like to see. This is something that can be conducted from high performing employees and also those who, aren't necessarily considered high performing. And then it also can be done or by a couple different people. Some organizations have state interviews conducted by the Human Resources Department. Some folks also, and I apologize, it got cut off from this slide, but they also do it by a direct supervisor. And some say that this is better served if it's coming from a direct supervisor. And then on the other hand, some say that it is better served to have it come from Human Resources Department. I would say either way, however you want to start it, is okay, right? There is no necessarily right or wrong answer. I've read articles and read papers about, sort of arguments, if you will, for both. So I think either is valid. And these are just opportunities where you can have a one-on-one conversation with folks about what's going on. Again, why they stay, what changes they would like to see. It's really important for us to engage with our employees at a place where that is, it's just, a conversation. It's not, it's a free-flowing conversation to really find answers to the questions that you're asking. And speaking of questions that you're asking, these are just 5 examples that you could ask when you are, asking these questions. So first question is, when you travel to work each day, what thing do you look forward to? What are you learning here? Why do you stay here? When was the last time you thought about leaving our team and what prompted it? This is a hard one, but it's also something that's really good to hear the answer to, because you want to know how they processed it and what happened to make them, want to leave, right? And then finally, what can I do to make your experience at work better for you, right? So again, figure out why they stay, why they maybe thought about leaving, but then also what can you do? What can I do? So if I'm the supervisor and I'm having this conversation, or I'm the HR professional and I'm having this conversation, what can I do to make your experience better, right? What can we do as an organization? What can I do personally to make your experience better? And so these, again, these sometimes are maybe not the easiest conversations to have, but at the same time, you can also get some really great ideas. The very beginning of this session today, we talked about co-creating those solutions. And so when you ask people like question 4 about, about number 5, where what can I do to make your experience better? That's just one way that you can help to really get that data to co-create those solutions. So, again, these are very non-pressured situations, non-pressured environments. And the more you conduct stay interviews, the more honest answers you're going to get. And folks will just be, you're going to create that culture of communication, of transparency. And so these stay interviews, again, are just a wonderful, wonderful way to do that. And so I know we talked a little bit about, and you all said in the last Slido, you said you were conducting stay interviews, but I would love to know specifically, yes or no, if you are currently conducting stay interviews in our Slido poll here. So how many of you are currently conducting stay interviews? Okay. So it looks like we've got just about half of our participants have taken the poll. And it looks like so far we have 55% of you who are on the call today don't currently conduct stay interviews. 57 now, 57% of you don't conduct stay interviews. But for those that have taken the poll, 42% do. So kudos to you all for doing that. And just for sort of another element in chat, if you all wouldn't mind sharing whether or not HR conducts the stay interviews or if the supervisor does. I'm really interested to know that too. Because again, I think that they both have merits and they both have valid reasons why you would use either approach. But I'm curious, if you conduct stay interviews at your organization, does HR staff do it, or does your direct supervisors? Okay, so for those who have answered, sorry, let me make my chat a little bit bigger. Folks, so sorry. And I apologize. My chat box was closed a little bit, so I want to make sure that I get to these here. So I am going to go back here because most of these are related to stay interviews. So HR staff, direct supervisors, they are not currently doing stay interviews, but considering them doing a part of their overall annual evaluation. That's great. The direct report, okay, so this person said that their direct report does it unless the employee wants to do it with HR. I love that you give them the option, Kareen, that's awesome. And then, so I wanted to make sure that I addressed the questions relating to the stay interview questions, and I hopefully that it was answered because it was a little bit while ago. Okay, awesome. And also I also wanted to call your attention to the chat. Sarah put in some, as we're talking about stay interviews, she put in 2 different resources that I would recommend, whether or not you're doing stay interviews right now. One is Dick Finnegan. So he wrote a book called The Power of Stay Interviews. It's great. He recommends that the direct supervisor does them. But again, I would say that either one is is valid and gets great data. And then SHRM, the Society for Human Resources Management, also has some wonderful resources related to state interviews. So both of those places can be wonderful, whether or not you're doing them or not. Currently, they're really great. Awesome. Okay, perfect. All right. And Kelly asked, so while we're still talking about this, Kelly asked, do you find it hard for staff to give honest answers? And I'm not sure whether she was referring, or Kelly was referring rather to HR or direct supervisor staff. So if you're doing state interviews, do you find that folks are, yeah, I guess yes or no, that folks are giving honest answers? Because this can be tough, right?
Just as a reminder for anyone, if you want to answer questions aloud, you can click the raise hand icon and I can unmute you so you can share with the group, in addition to entering things in chat.
Awesome. Thanks, Sarah. Sorry, I'm talking in I'm completely on mute. So Alicia put into chat talking about honest answers, that yes, that they are able to get honest answers, but honesty is on the level of relationship that the supervisor has built. So true. And so if you're having supervisors conduct that, just keep in mind that each relationship is going to be different. And so some folks might be more honest than others, depending on that supervising relationship. And then Karine put in that not everyone is honest, but it opens the door to build that trust. Yes, absolutely. Having these like non-pressured conversations where it's not something that the staff or the clinician is doing wrong or whatever. It's just a conversation. Like, hey, what do you like about coming to work? What maybe do you not like so much and made you want to leave? And then what can I do to be better and make your job better, right? I think that opens up a little bit of vulnerability. And so they can be a really great jumping off point for these conversations. And so, so if you're not currently doing them, I know they can be somewhat of an undertaking, but they do provide valuable data and also build their trust too, as Karine mentioned. So thanks everybody for participating in that as it relates to state interviews. And while state interviews do have some really, and give us some really great data, there are also some, so that gives us our qualitative data, but then we can also take a look at our human resources data and also other benchmarks that we have that fits into that quantitative side, right? So things like turnover rates, our retention rates, and also, again, more qualitative data from exit interviews as well. So while state interviews are great because folks aren't 1 foot out the door and already headed out the door, things like exit interviews are also good too, because it tells people, you know, it's going to tell your organization why folks are leaving. And if we look at all of this HR data, we can look at it as a whole organization, and then we can also look at it from each individual site and also each individual department too. That's really important. That's really important too, because we want to make sure, again, as we mentioned in a couple different, a couple slides ago, that by looking at this data from an individual department, individual site, it really can paint a picture of our workforce holistically, because we can't just look at one site and say, okay, this is the picture of our entire organization, especially if it's a large one. Now, if you have a one-site organization, that's different. Obviously, you're not going to look at different sites because they don't exist. But we want to make sure that we are looking at all of these different data points as we're looking at our current state of being, so that we can get to the place where we want to be and have that strategic plan as it relates to workforce there. So you really, and there could be other data points that you leverage. We mentioned a few on the beginning of this, but you really take a look at all of your workforce data to see how you're doing in your current state of your workforce and as you assess your current state of your workforce. And I believe that second to last slide question, I would love, and we all would love, to know what data from human resources do you use to assess your workforce. As I mentioned, not only do you have turnover data and retention data, but what else do you use? So in this Slido, we have turnover rates, retention rates, qualitative data from exit interviews, other, and also not applicable. And you can select all that apply. So if you're collecting all of these and you're using all of these things to assess your current state of your workforce, we'd love to know. And this is relevant. I know that Alicia put this from the state interview process, but they mentioned in chat rather that workforce, they're working on building into our onboarding process several touch points for HR to see how things are coming along too. That is great. Onboarding is another great place to gather data as far as how folks are doing. So that is awesome. Thank you so much. Okay. All right. So I'm going to wait about another 20 seconds to see what folks have answered as far as what y'all are using as it relates to data and benchmarks in your organizational workforce assessments. Okay. So 56% of you are using that qualitative data for from your exit interviews. Yes, that is really important, and so glad that you're asking those questions, even though they're already leaving. You're using that. That's wonderful. Retention rates, 50%. So 50% of you are using retention rates as a part of how you're assessing your workforce. And then there are some of you. So 17% say that that's not applicable, and then 11% said that you're not using data, any HR data to use to assess your organization's workforce. That's not something that you're currently doing. Maybe you're using, other surveys or things like that, and you're just not using HR data. And for those of you who answered other, if you would like, feel free to put either something in the chat or raise your hand and Sarah can unmute you. Apologize. The turnover rates, I somehow missed the turnover rates. 67% of you are using turnover rates when you collect or when you are assessing your workforce. So that's awesome and a really helpful thing to do, especially when it comes to breaking it down by department, position, and also site too. So that's really great to use. So thank you all for sharing what types of data you're using. All right. And so finally today, we want to talk about addressing bias and discrimination in the workplace as it relates to our, really creating and assessing your overall state of your current workforce. And so, as I mentioned early on in this presentation, that addressing bias and discrimination in your workplace is very important at creating the place where people want to be and creating a healthy and resilient organization as a whole. And so when we think about this, we want to make sure that we are developing a clear policy for reporting bias and also discrimination, including how reports will be handled. And so we want to make sure that all of those policies are written and they are also available if someone asks about them, right? And so this is something that we should be very transparent about in our workplace, because people want to make sure, again, it goes back to that psychological safety. We want to make sure that there's a policy for addressing bias and discrimination. It is as well as the legal ramifications and all of these things with discrimination. And so we want to make sure that we are addressing those, having written policies about how those things are going to be handled. We also can have or should be having include those questions about diversity, equity, and inclusion questions and staff satisfaction surveys. All of those things are very, very important and are a vital part of employee engagement, employee satisfaction. So when we think about our, highest and best state of our workforce, we want to make sure that that we are addressing DEI, diversity, equity, and inclusion at the highest level. And so really having those questions be a part of our staff satisfaction surveys, it's really important for us to be able to address them and for us to, for organizations to be doing better. DEI is something that is a continual work in progress. And so we want to make sure that we're continuing to measure those things through our staff satisfaction survey. And then another thing that organizations can do to address bias and discrimination in the workplace is to conduct workforce racial equity assessments, right? We want to see how we're doing as an organization when it comes to workforce racial equity. And one of the things that we have as a resource here, and I believe it is linked in the slides that you all will receive, but it is the Building an Inclusive Organization Toolkit. This is a fabulous, fabulous toolkit that was developed by the Association of Clinicians Star Center, along with several different national organizations. And it really takes a look at holistically what organizations can do to really be more inclusive, and also give some examples of how some organizations are developing things like DEI statements, how folks are using and being intentional about diversity, equity, and inclusion in their recruitment practices, in their in their job announcements, all of those different types of things. It really is a wonderful resource. And if this is something that you feel, you can work on in your organization, feel free to take a look at that. And thank you, Molly, for putting the direct link in the chat. I really appreciate that. All right. And so, yes, this is our last Slido question here. So love to know, how are you addressing bias and discrimination in your workplace, right? It could be several different things, and we would love to hear from you in our last Slido poll. So a couple of our different options here. So we have, and I believe this is a select all option again. So we have a clear policy for reporting bias and discrimination. We include diversity, equity, and inclusion questions in our staff satisfaction surveys. We conduct workforce racial equity assessments. We don't have any organization-wide means to address bias and discrimination workplace. We also have a place for other and also not applicable. So I'd love to hear from you all as to how you all are addressing bias and discrimination in your workplace. All right, we'll give it a few more seconds here for folks to participate. Looks like we have about 10%, or excuse me, 20% of folks have answered so far. All right. So far we have 86% of our organizations, or most of our organizations here, rather, it's changing all the time. So I apologize that I keep switching numbers, but as you all are answering, the numbers keep changing. About let's just say about 3/4 of the folks that answer have a clear policy for reporting bias and discrimination. 29% include diversity, equity, and inclusion questions in staff satisfaction surveys. About 11% of folks don't have an organization-wide means to address bias, discrimination in their workplace, and then 17% said other. So that's great. Thank you so much for answering that question. And we also had someone that put into chat that they have an assessment survey. So awesome. Thank you so much. And however it is that that you do this, or no matter where you are, it's not too late to start. This is something that is has really become, something that a lot of people are talking about, and so it feels more accessible for folks. It doesn't feel as much of a far reach, and this is something that we absolutely should be doing, and we want to make sure that we are, no matter what it is that we're doing, that we're starting. And so that building an inclusive organization toolkit is a great place to start if we're not assessing bias and discrimination in our work and our workplace. That's a great place to start. All right, thanks everyone again for answering. All right, so that's it for us today. In our next session, we are going to be speaking about leadership and policies as a part of the 6 domains of evidence-based and promising practices to increase clinician well-being. So, so you don't want to miss that session. And with that, I'd love to know if there are any questions or comments. You can either put them into chat. Okay, Molly, thank you. Please post any questions in the chat there that you might have.
And I'm also happy to unmute anyone who raises their hand to ask a question or share a thought with the group.
Perfect. Thank you, Sarah. And we'll give folks a second either to put their questions in chat or to ask to be unmuted. Okay. And while you all are coming up with your questions or raising your hands, I want to, just a lot of things that we talked about today. Sarah and Molly put some wonderful things in the chat, so I hope that you were able to click on those clickable links and take a look at all the different resources. And we also have some resources on nhsc.hrsa.gov as well. So I just wanted to point those out. Awesome. And I believe we have a question or a raised hand. I believe, Molly, is your hand up? I believe that's you, Molly.
Thanks, Suzanne. I was curious, in your work with health centers around creating strategic plans and looking at workforce retention, how have you seen them incorporate organizational resilience and clinician well-being in those plans?
That's a great question. So organizational resilience is something that has never been more important and never been more talked about. And so there are a bunch of different ways that we can folks can incorporate resilience in there, or just well-being into their overall workforce plans and workforce strategic plans. So one is making sure that folks have adequate time off and they are encouraged to take that time off. It's hard for us to be our whole and best selves if we're not spending time away from our job, even though we are passionate about what we do and we love what we do and we love our patients and all of that. Having time off and making sure folks are encouraged to take time off is really, really important. We also want to make sure that folks are also given the resources they have for professional development. This is a great not only retention tool, but it's also something that helps folks develop resilience and also develop and also increase their well-being, right? And so really give them resources for professional development. So that time, those financial resources, and all of the different things that go into professional development there. We also want to make sure that we are, compensating folks, and we have our compensation strategy. Really make sure that's comprehensive as a part of our overall workforce strategic plan. And this is something that is not just a paycheck, but also our benefits too. So we want to make sure that we're looking at our benefits to have that work-life integration. We talked, someone mentioned EAP programs. There are a ton of other benefits that folks can get super creative when it comes to those benefits, to really help build organizational resilience, build their overall well-being. And this is something that's really important to talk to your staff when you're thinking about your workforce strategic plan and your this benefits. The world is your oyster, as I say, when it comes to benefits. And so talk to your staff. What benefits do they want? And what benefits do they not use, right? And so by assessing that on a regular basis is really important. And then also, looking more broadly, more strategically as it relates to workforce, take a look at your staffing models, your staffing plans, and your staffing needs to make sure that you have adequate staff, and that all of the different areas are covered, and that you are anticipating future needs, so you don't get caught by having, if you end up having a new site, or you have a change of scope and you're including dental where you weren't previously, or a dental at a new site. You want to make sure that you're anticipating those workforce needs, and that's something you can think really strategically about, because if you're not thinking strategically and not anticipating those needs, then you're going to overburden your current staff. And so you want to make sure of that as well. So lots of different ways that folks really take a look at their workforce plan strategically, and really increase the well-being of their staff. So hopefully that give folks a few things and answers your question, Molly. One more thing I just thought of, also too, relating to overall workforce. And I believe this is going to be covered in another session, but also having folks that are a C-suite level position that's just related to workforce. So some folks call this a chief workforce officer. Some folks call it a chief HR officer. But having somebody who's thinking about workforce strategically and not just being reactive can be extremely helpful. This might not be something that everyone can do, but as possible, it could be something that if you have the resources to do, it could really pay off in dividends. And then also, finally, one thing I didn't mention before is to really to live into the mission, and to really live into and really be cognizant of your diversity, equity, and inclusion within organizations. Representation is important. Representation is important to employees, is important to patients. And so we want to make sure that, really we're building those inclusive organizations. So hopefully that's answered your question. Any other question? All right. With that, that's all the content I have for you. Sarah, I'll turn it back over to you if there are any closing items you'd like to address.
Thank you so much, Suzanne, for your presentation today, and thank you to all of our attendees for your participation. We're going to open up one final Slido, which will just be an evaluation poll to help us collect some feedback on today's session. Should see that opening soon. So please go ahead, and we'll give you a few moments to complete that. I just want to reiterate what Suzanne said about the resources. So as I mentioned, there are resources that are on these slides, which will be posted on our webinar registration page. And healthy and happy and practice with confidence. Please make sure you're registered, and we hope to see you then. Goodbye, everyone.